Think Health.
Did you know that almost 200,000 liposuctions were performed in 2009, and 85% of them were performed on women? Hello, I'm Dr. Paul Vanek, and I'm a board-certified plastic surgeon. Welcome to Think Health. While liposuction is not a therapy for obesity, its popularity as the #1 plastic surgical procedure has to make one wonder which is the most effective method of safely reducing the unwanted inches found in our patients. Because of my background in biophysics research, my review of the literature, as well as research personally performed, I've concluded that vasor liposuction is a clearly superior liposuction method for my patients. When compared to traditional liposuction methods in the same patient, my co-investigators and I found that the skin contracture was 53% better on the vasor-treated side. Vasor treatment was also shown to have 23% less blood loss compared to the regular liposuction side. These findings were presented at the Michigan Society of Plastic Surgery and have been accepted for publication in the journal Plastic and Reconstructive Surgery. When we look at the laser methods with an L, the lack of selectivity is immediately evident because the wavelengths of the laser energy essentially don't selectively treat the fat. The laser fiber is instilled under the skin level and it non-selectively cooks all the tissues. While it may reduce the fat layer, liposuction techniques destroy tissue you want to keep like nerves and lymphatics. Ultrasound techniques have the most selectivity for treating the fat and leaving alone the tissues we want to preserve. Let's look at some of my vasor results. Here's a 25-year-old who was very happy when I vasored her baby fat neck. This 29-year-old dieted and lost 35 pounds, then underwent vasor of the abdomen and flanks. This 45-year-old from Mentor had vasor of her thighs and calves. She loves her new contours. This 42-year-old Cleveland woman wanted to have the back, flank, and abdomen fat transferred to her buttocks to give her a more attractive bottom and a much flatter tummy. Her Brazilian buttock lift results are shown here. This beautiful 48-year-old Cleveland mother was so happy after her abdomen and flanks were reduced with vasor. This 37-year-old woman from Rocky River lost all her weight except in her arm areas. She had a great skin contraction after vasor. Joining me now is Elizabeth Bradick, who has 2 beautiful boys. Welcome, Elizabeth, to Think Health.
Thank you, Dr. Vanek.
You weren't getting the results from diet and exercise that you wanted when you came to see me. Tell me how you felt about your thighs and your stomach.
I really felt there was more that I could have done to get that shape and contour that I really was looking for.
And now that you're recovered from your April surgery, how do you feel about your results?
I really like them. I'm very pleased with the way that my shape looks. My feeling in clothes is just totally different.
And what would you tell our audience about vasor liposuction?
I think I'd say that in general, it feels very comfortable and there's minimal intrusivity when it comes to the surgery itself, and your office really helped with that, and very little pain, very comfortable.
Well, thank you for joining me in my Think Health today.
Sure.
Patients love the smooth and selective contours achieved with vasor liposuction technique. If you'd like to learn more, then call or click over to my website, paulvanekmd.com. Until then, it's my pleasure to help you think health.
Think Health.